Hi everyone, I'm Mary Westby. I'm the program director for the athletic training major at Gustavus Adolphus College, and I want to welcome you to our website and to some information about our athletic training degree. Now I'm talking to you specifically who are seniors in high school or who will be entering Gustavus in the fall of 2020. We have some changes happening in the profession of athletic training during this time, and so it's really important that you kind of follow along with when you will be entering Gustavus as far as your options for athletic training. So first I want to give a little background on athletic training. So some of you might be really familiar with athletic training. Maybe you've worked with athletic trainers at your high school currently, and maybe you've done some research ahead of time. But some of you might just be coming to athletic training and coming to what this profession looks like. So our national organization is known as the National Athletic Trainers Association, or the NATA. So the link that I have on the screen is for their information about athletic training, kind of background on athletic training. So feel free to visit that to get more information. But just kind of to summarize a little bit of what we have here, athletic training encompasses the prevention, examination, diagnosis, treatment, and rehabilitation of emergent, acute or chronic injuries and medical conditions. So what that's saying is we are a healthcare profession. We deal with the healthcare of individuals who are physically active, specifically looking at prevention and treatment and rehabilitation of orthopedic injuries, injuries to the muscles and bones and joints of our body, but we also do some work with more general medical conditions, especially those that physically active individuals might have involved in their body. So things like asthma or gastrointestinal issues, so stomach issues, or diabetes or things like that. We also look at kind of the idea of participating in your activity safely. So how do we, again, prevent injuries, things like environmental conditions, things like that. So we are recognized by the American Medical Association, the Health Resources Services Administration, and the Department of Health and Human Services all recognize us as healthcare, allied healthcare professions. So athletic trainers are the highly qualified, multi-skilled professionals that collaborate with physicians. So we always work under the direction or with a physician in order to treat our patients. We follow the rules of the state that we are licensed in, and we follow the code of ethics of the profession. So I have a quick little background video. This comes from what's called the Professional Football Athletic Trainers Society, or PFATS. So it's the Indianapolis Colts athletic trainers giving a little background on athletic training and why it's important, in this case especially talking about youth sports, but why it's important that people have access to athletic trainers.
Hello, I'm Kellen Norris, Assistant Athletic Trainer for the Indianapolis Colts. I want to talk with you about athletic trainers and why they are vital to the health and safety of your young athlete. Oftentimes, athletic trainers are mistaken for coaches and personal trainers, when actually, athletic trainers are healthcare professionals who collaborate with physicians to provide preventative services, emergency care, clinical diagnosis, therapeutic intervention, and rehabilitation of injuries and medical conditions.
Hi, I'm David Walston. I've been an assistant athletic trainer for the Indianapolis Colts for 23 years. Athletic trainers are on the field to take care of your young athlete in emergency situations. Athletic trainers are trained in emergency situations found in sports such as fractures, dislocations, concussion, spinal cord injuries, exertional heat stroke, and many more. Athletic trainers are also trained in environmental conditions such as lightning safety to ensure a safe environment for practices and games. Having a trained medical professional on the field with your athlete in the event these situations arise is vital to the proper care and a successful outcome.
Hi, I'm Kyle Davis, Assistant Athletic Trainer with the Indianapolis Colts. I want to talk to you about the importance of athletic trainers in clinical diagnosis. It's important to have an athletic trainer at your club, league, or school games because it gives your parents and coaches a peace of mind. It's having someone there who is trained in clinical diagnosis of orthopedic injuries and general medical conditions. It's having someone there that, once diagnosed with an injury, can give you the proper at-home care instructions or guidance about referrals to physicians. Athletic trainers are also trained in the rehabilitation of injuries. They specialize in taking your athlete through rehabilitation process and safely return them to play. Athletic trainers are a valuable resource in times of injury to your young athlete.
As you can see, athletic trainers are a vital member of any club, sport, league, or school. Having an athletic trainer present can give you the peace of mind when an emergency situation occurs. There is a trained medical professional who specializes in athletic injuries there to attend to your child. Having an athletic trainer gives you a resource for diagnosis, guidance for referrals, and rehabilitation of these injuries sustained. Please help us in advocating for athletic trainers and the safety of young athletes by talking to your league, club, or school about the importance of having an athletic trainer. For more information on athletic training, please visit the Professional Football Athletic Trainers Society website, www.pfats.com.
Okay, so again, just a little bit of background on what athletic training is, and hopefully it can give you some insight into what you're maybe thinking of going into. So it's just as important then to know what athletic training is not. So they talked a little bit about this in the video, but we are not quote unquote trainers. So oftentimes if you have been exposed to athletic trainers in the past and you called them a trainer, they might have kind of scolded you a bit and said, no, please call me an athletic trainer. And the reason for that is a trainer could encompass lots of different professions, anyone that has training in their name. So we just want to make sure that we are distinguishing who we're talking about. So again, athletic trainers are healthcare professionals. They're dealing with the injuries and treatment of those injuries in a healthcare setting. What we're not are personal trainers or strength and conditioning coaches. Those individuals work with individuals on performance and improving performance. Some athletic trainers do that. They're what we call dual credentialed. They have a personal training and strength and conditioning coach degree or credential along with athletic training, but not all athletic trainers are strength and conditioning coaches. If that is something that is really interesting for you, we have a great exercise physiology major at Gustavus, and I would encourage you to look into that. We do have students who double major with athletic training and exercise physiology, so that's an option as well. We're also not coaches, even though we're involved with the teams in the collegiate and secondary school kind of settings. We are not on the coaching staff. We are a separate organization and have medical direction to do the right thing for our patients. If coaching is something that interests you, we do have a coaching minor as well in the Health and Exercise Science department at Gustavus. We are not any other healthcare profession, so physical therapy or other occupational therapy, physician assistant, medicine. We are our own healthcare profession. So there are several people who are what we call dual credentialed, meaning they did an athletic training degree and then chose to go on and get another degree in a different healthcare field. They then are credentialed for both of those things in whatever state they work with or work in. And so with pre-health, with things like physical therapy or other healthcare professions, those are post-undergrad degrees. It's what athletic training is actually moving to, and we'll talk about that in a minute. But these positions or these professions, you do whatever major you want at Gustavus or wherever you choose to go. And as long as you are also completing what we call the prerequisite classes. So those are classes that are going to be required for that school for physical therapy or med school, things like chemistries and biologies and psychologies, different classes like that. You take those along with your major classes and then you apply to those programs. So that is another option available out there. We do have some students who choose to do the athletic training undergrad degree, the bachelor's degree in athletic training, and then choose to apply to other healthcare professions afterwards. And again, they're going to be that dual credentialed where they've become a certified athletic trainer and then they get another degree in another healthcare field and they can practice as one or both of those degrees. Athletic trainers work with anyone who is physically active, and so they show up in a lot of different job settings. So again, our National Athletic Trainers Association has some resources on where to find these. I've also linked a bunch of videos here that you could go back and look at for the different job settings that athletic trainers are in, anywhere from the traditional things like schools to professional or Olympic sports, performing arts, military, public safety, working in clinic hospitals or rehabilitation clinics, doing what we call industry athletic training, so working with occupations. For example, Delta has athletic trainers that work with their employees, especially their baggage handlers, to make sure that they're treating any of the injuries they might have on their job. Or some combination of that. So if those things interest you, a lot of these videos are kind of day in the life videos, and they can kind of walk you through what that looks like to be an athletic trainer in that environment. Okay, so let's talk about how you become an athletic trainer. So currently, athletic training programs can be either master's or bachelor's level. That is changing. In about 2022, all programs will be transitioned away from being bachelor's programs and into being master's programs. Your class, so the class that is going to start at Gustavus in the fall of 2020, you will be our last class of undergrad students, because we will be discussing and working on what that transition means for Gustavus. So you will still have the option to do the athletic training degree as an undergrad degree, and I'll go through that process. But you also have the option of doing a different degree at Gustavus and choosing to do a master's program, either at Gustavus, if and when we get that approved, or at another institution. So if you're looking at schools right now, think about what route you want to go. Think about if you want to do athletic training as your undergrad degree, or if you want to go on for a master's, and do some investigation and find the right place for you. So right now, again, your options are to do a 4 years bachelor's program, which is what Gustavus is currently. You could also do a 4-year bachelor's anywhere, where you're any major, but you take prerequisite classes, and then you apply for a master's program, either at the institution that you did your undergrad on, if they offer that, or at a different institution. And that would typically be a 2-year master's program. And they have to be what we call CATIE accredited, which is the Commission on Accreditation of Athletic Training Education. In order to become a certified athletic trainer, to take our certification exam and actually be able to be a practicing athletic trainer, you have to go to either an undergrad or a graduate program that is CATIE accredited. So whenever you're looking at schools or talking to schools, make sure you ask about that. Some schools are also doing what they call an accelerated program, which they do an accelerated undergrad degree. You get it done in 3 years instead of the traditional 4, and then you do your 2 years of master's work. And so you get done in 5 years instead of the traditional 6. So looking at Minnesota specifically, these are the options that you have for where to go to school in Minnesota. So Bethel University has a master's program in athletic training. So you can do either the 3+2 accelerated version, or the 4+2 version there. College of St. Scholastica, same thing. You can do 4+2 or 3+2. Minnesota State University Mankato, they do not have a 3+2 option. They only have the 4+2s. So you can either do your undergrad degree at MSU Mankato and then do your master's degree there as well, or you could go to a different undergrad school and then apply for the master's program there afterwards. Gustavus, we are still working on our plan. So we're in the process of going through some of the approval process of what it would take to be a master's program at Gustavus. We would be the first, and for a while the only, master's program at Gustavus. But we are still in that process, so we cannot guarantee or talk really about having a master's program at this time. But we can show you some options of what that would look like if and when that does happen. Again, that is in the future. You still, as someone entering Gustavus in the fall of 2020, have the option to do our undergrad degree. And then Winona State University also has the accelerated or the traditional 4+2 options available. There is a link down here to other institutions. It's the CATIE, the Commission on Accreditation of Athletic Training website, so catie.net. and then it's search for accredited program. And there's a button on the screen where you can do a whole kind of search feed of programs in other states if that's something that interests you. But let's talk a little bit about our undergrad program first, and then I'll talk about some of the other options if you're thinking about wanting to do the master's in athletic training. So here's the link, gustavus.edu/HES/ATR. That is our website, and this is the website currently for our undergrad program. So our program is really based on 2.5 years. So you come to Gustavus for your first year. You don't have any requirements that you have to get done. You're really being a first year student, getting a lot of your general education classes in place and things like that. And then in the fall of your sophomore year is when we introduce you to the athletic training program and you apply to the athletic training program, and then you enter the athletic training program in the spring of your sophomore year. So it's a 2.5 year program. And during that time, you'll be engaged both in the classroom for classes and also what we call clinical education. So all of our students do clinical experiences with certified athletic trainers or other healthcare providers in a variety of settings that athletic trainers tend to work in. And that's getting you not only observation experience, but really hands-on experience. You will work with patients. When you have the skills and the competency in certain material, you're then allowed to apply that onto patients during this time. And so it's really a great opportunity for you to learn in the classroom and then be able to apply fairly quickly after that. So students get hands-on education in the domains of athletic training in order to prepare for the National Board of Certification exam. And our students, typically our undergrad students, take that in the spring of their senior year. So we would be preparing you throughout your time in the athletic training room and the athletic training program to take that exam, usually the March-April, it's the last week of March or the first week of April, to take that national certification exam. And once you pass that certification exam, you're eligible to work in any state in the country. They have other expectations for their licensure that you might have to fill out, but everyone uses essentially that Board of Certification exam as their kind of gateway of how to be an athletic trainer in the different states. Some things to kind of note is this has a lot of out-of-class expectations. Those clinical experiences are going to happen several days a week and continue to grow, and the requirement grows as you mature in our program. And so there's a lot of thought that needs to go into that. You need to make sure you're dedicated to the major and a desire to become an athletic trainer. You're going to be putting in a lot more hours than your typical friend who gets to go home and Netflix and chill or play video games after classes for a couple hours and then do a couple hours of homework. You're going to go to class, then you're going to go to clinicals, then you're going to do your homework. And so it's going to add a lot of time commitment that's needed. So time commitment, there's going to be some compromise. You're not going to have all the free time that you had or that your friends have. You need to be flexible because schedules change, and you might thought you had clinicals this day, but now the weather's changed, so baseball canceled their game, so now you have a different type of clinical. And our academic rigor is pretty high. These are science-heavy classes. We're expecting you to be able to care for an individual, to be a healthcare provider, and we're going to hold you to those expectations. And then because of those clinical experience placements and commitment, we do have an application process. We typically take 12 to 14 students, and that's in order so that I have placements for you that you can get a really good hands-on educational experience. So we limit the number of students we have so that every educational experience can be really great. So typically 12 to 14 students are allowed in every year. And that is based on academics, desire to be athletic trainer, the time you spend doing some observation time during our introduction to athletic training class, and things like that. So just kind of a quick overview of what your 4 years at Gustavus would look like to do the undergrad major. Your first year, you're not going to have any requirements. There's a couple classes you could take just to kind of keep working ahead on some of our expectations, but there's nothing you're required. Get on campus, be a first year, get some of your general education, foundational knowledge classes in place, and then focus on your declaring your major and athletic training your sophomore year. So fall of sophomore year, by that point, you either have to complete or be in the process of completing our prerequisite courses, and I'll show you what those are. The main course that we have is Introduction to Athletic Training. And during that class, we explain what athletic training is. You learn a bunch of the different, what we call domains of athletic training, the areas of practice of athletic training, and you'll do some observation time with our certified athletic trainers at Gustavus. Again, making sure that you really know that this is the major you want to go into and the profession that you want to go into. And then usually the week before Thanksgiving, our applications are due, and we'll go through those. January is when we find out about admissions. So we're waiting for fall grades to be posted. We've done interviews and other things. So typically we're able to inform everyone kind of the second week of January if you've gotten into our program. And then you would officially start our program in the spring. And so you'd have about 3 core classes that you would take, and you'd begin our clinical experiences, and you would do clinical experiences about 3 times a week. Junior year, that goes to 2 to 3 courses that you take, and clinical experiences kind of bump up to 4 to 5 times a week. You'll also start doing some of our off-campus clinical experiences during that time. And then senior year, we're to 1 to 2 classes per semester, and your clinical experiences bump up. So we drop down on kind of the classroom expectation and bump up on the clinical expectation, because by that point, we've kind of taught you all the skills to work with patients, and now we want you to really get out there and practice it and keep perfecting it. And then, like I mentioned, you would apply and take that BOC exam in the spring. So this is a typical 4-year plan. Some classes, once you get into the program, are very sequenced, and you'd have to take one before the other. Other ones, things that have the asterisks by them, those are things that can be taken in multiple semesters. So anything in red are our prerequisite classes, so you can see that there's multiple semesters that's available to take. But by the fall of sophomore year, you need to be enrolled in our Introduction to AT class, our Human and Anatomy and Physiology 1 class, First Aid and CPR, and then our Biomechanics and Functional Anatomy course. So some of you might be able to take those classes earlier as first years. Maybe you had an AP anatomy course in high school, so you feel confident going into anatomy here, or maybe you had some other courses. Those would be things that you can take as a first year, but none of this is required. You can fit it all in sophomore year. One class that you can be kind of looking at to fit in some point during your first year, or again your fall of sophomore year, is this Introduction to Public Health course. That's a great course that if it's open to you anytime kind of early your first year or your sophomore year, that you can take that course is really nice, because it gives you a good introduction to health professions in general, but specifically public health and how we help people on a public scale. And then that's our senior year. So again, you can look over those kind of as you will. Our clinical experiences, like I mentioned, are tied to our courses, and they kind of grow as you grow in the major. So you can see we typically do on-campus ones as sophomores. Then you start to go and do some off-campus ones with the Mankato Clinic and our health service at Gustavus, along with a local high school. And then by senior year, you're doing usually a longer on-campus. We try to let you get to see a team from kind of the start when athletes report to then the end of their season, and so you can really bond with your patients and have that experience. You'll also do physician clinic and surgery observation with Trio Orthopedics. You'll do another high school experience, and we also work with our students to have a customizable experience. So that whole list of where athletic trainers are working, maybe you really know that you want to do dance medicine. We'll work with you to try to find an experience where you can be working on that as a senior. Our application process, as I mentioned, happens in the fall of sophomore year, so there's nothing you really have to worry about in your first year at all. And we'll do advising meetings and things like that to help you if you have interest in athletic training once you get here. So I won't really go over the full application that you see there, but you can find everything on our website as well. Now you guys are in an interesting place of, you get potentially a choice. Do I want to do athletic training as an undergrad major, or do I want to wait and do it as a master's? Honestly, there's no right answer to that. You and your family have to decide what's going to work best for you. The degree doesn't necessarily matter when it comes to actually working as an athletic trainer. What matters is that you go to an Acadie accredited program and graduate from Acadie accredited program, whether it's a bachelor's degree or a master's degree. That's what lets you take that national certification exam, and the national certification exam is what allows you to become an athletic trainer. So right now we're not anticipating any difference between you being a bachelor's with an athletic training degree or being a master's with an athletic training degree. And some of our bachelors with athletic training choose to go on to what we call post-professional master's programs for athletic training. And that would be like when a doctor goes and does a residency or a fellowship. So you've already kind of gotten into your entry-level position. You are an athletic trainer. But let's say you want to learn more specifically about working with pediatrics, or working in a physician's clinic, or want to specialize in something. You can go on for more advanced schooling from there. So you still have that option if you do the undergrad degree versus doing the master's degree. And master's degrees have that option too. They would just do it after completing their master's program. So really it's up to you and your family and what works best for you and where you find your peace. But let's say you want to come to Gustavus for your undergrad, but you don't want to do athletic training as your undergrad major. What are your options? So these are some typical prerequisite classes for athletic training master's programs, either in the state of Minnesota or elsewhere. Now, every program has their own set of prereqs, so you'll want to look at the specific program that you're interested in going to, or the programs that you're interested in going to, but these are usually some general ones that are typically required. So it's usually at least 2 courses in psychology, so that can be general psychology, maybe abnormal psych, or a sports psych course. At least 1 course in physics, and really those should include all of these topics. So sometimes all of those topics are spread out over 2 courses across a full year, and then you would have to take both semesters of it. Other times those are all in 1 semester, and you can get it done in 1 semester. At least 1 course in biology and 1 course in chemistry, or sometimes some schools have a combined biochemistry course, maybe for pre-health majors or things like that, and that would be something you could take. You need 2 courses in anatomy and physiology. Some schools combine anatomy and physiology and have 1 and 2. Other places you take an anatomy course and then you take a physiology course. A course in human nutrition, a course in statistics and or research design, 1 course in biomechanics, and then a course in exercise physiology. And again, other schools might have additional prereqs or additional recommended courses. You would just need to look at your schools. But looking at just these classes, what I have highlighted there are the classes at Gustavus that you could take that would help you fulfill those requirements. And so we have specific courses that match kind of all of these that are options. Again, we'll have some options for physics for you. We have options for the biology and the chemistry. I would recommend you can be any major that you want and go into athletic training, just like we talked about with other pre-health programs, as long as you're doing the prereq classes. But one that's really nice and a major that would really help fit what athletic training is our exercise physiology major at Gustavus. For that major, you're required to take anatomy and physiology. You're required to take human nutrition, statistics and research design, biomechanics, and exercise physiology. So you would get to count these classes towards your major and count them as prereqs for your master's program. So that's really nice. It opens up space in your load to do your other general education classes that you're required to do. So a typical 4-year plan for someone doing this, if they're thinking of going exercise physiology and thinking they want to be pre-AT, and this is to be an athletic training master's program. Hopefully there might be one at Gustavus that you could complete. Or that we would prepare you to apply to a master's program somewhere else if Gustavus is not up and running by then, or if it does not occur. So first year, you would take what we call our first term seminar course. It's a class that you take. It has 16 students in it, and they're all first years. And so it helps kind of get you oriented to college and oriented to campus. And these are just recommended 4-year plans. You would not have to follow this to a T. These classes would just need to be done when you're applying to your program. So typically maybe Psych 100 and Bio 101 would be great to do your first year, and then another general education course of your choice. In January, we hope to have a class that is called Physics 101, which would be that combined semester physics. Otherwise, some point in your 4 years, you'd have to find a spot to take kind of Physics 1 and Physics 2 in order to meet those requirements of what's involved in the class. But hopefully we'll have that kind of straight. In the spring, you could take nutrition, which is our HES 222 course, which is one class that they really like you to have to be the exercise physiology major. And then 4 other kind of general education classes of your choice that you need to fulfill. Sophomore year is when you'd apply to the exercise physiology major, so in the fall of sophomore year. And so taking our anatomy and physiology course, taking one of your, we have a couple different options for chemistry, but they both get you to where you need to be. It's a single semester course or a 2 semester course, depending on how comfortable you are with your chemistry skills. And then the research and statistics class as a sophomore, and then another general education course. In January, if you did take that 106 course for our chem, you would take the 108 course. And then in spring, we would have our biomechanics, our second semester of anatomy and physiology. This is a class for your exercise physiology major called exercise leadership. And then one of your other psych classes, so either the sports psych or the abnormal psych. And this is also a great time that you could get involved with observing the Certified Athletic Trainers at Gustavus to, again, make sure that athletic training is what you maybe want to be doing. A lot of schools require some sort of observation hours to have been completed in order to apply as well. And then junior year, we have additional classes in your major, as well as classes that would count towards the prereqs for your master's program. If Gustavus has a program and it's approved, we would have that option for you to do that accelerated time. And so we would try to get you done with most of your undergrad degree in 3 years. And so you would be actually able to apply to Gustavus's program potentially in your junior year, if that's up and running by that point. We don't know if it will be yet. And then you could take the first aid CPR class in a January term as well. It's not required, but you will need to be certified in CPR in order to apply to most programs. And so this is a way to get that done while going to school. Otherwise, you could do a class in the community as well. And then again, taking your exercise physiology classes. Some of these are also prereqs. This is our exercise physiology course, and your general education courses. And then senior year, we have kind of 2 options that might be available to you. One would be to do a 4+2, right, where you completed your 4 years of time at Gustavus, and you're ready to apply to a master's program, either at Gustavus, if we have it available, or somewhere else. And so you would just have your 2 exercise physiology courses for your senior year. You'd have your general education courses, and that's what you would be completing in your spring as well. And you would apply to a master's program, whether that's Gustavus or somewhere else, if we have it available. The other option would be is if we do have that 3rd year or that 3+2 available, that accelerated time, you would actually then your senior year be starting our master's program in athletic training. And that would count back towards finishing out your exercise physiology degree. So we don't know if that's going to be in place. We don't know if we'll have a master's program at Gustavus. We're working towards that, but that's all we know for now. But we can really prepare you with our exercise physiology degree and the courses that we offer to be able to apply to any athletic training program at Gustavus or anywhere else for that matter. So those are kind of your 2 options. You can do our undergrad degree in athletic training and use that as your undergrad major, or you can do our exercise physiology or really any major at Gustavus and work on those prerequisite classes and apply to an AT master's program from there. So if you have any questions about either of those routes, please feel free to email me. My email address is mwestby@gustavus.edu, and I'd really look forward to any of your questions and helping you make your decision for your future. Thanks.